The good question is, what within what you know about your technique and what we discussed yesterday would you like to focus on? Is the question.
Well, I think I already used the for me it's then the basics. So I try to use the water immersion. I try to use the stiffener in the around the splenic flexure. I try to change positions, but yet then sometimes I still struggle, and then I don't know what to do. So I hope maybe there are some tips and tricks.
So just stop for a second, because there's a few things going on. So was it not your intention to use water from the outset? Was the first question. Were you planning to use water, or do you decide when?
I often use it, and then I saw it was not the first. Yeah, the first flexure is already a bit difficult, so I was already thinking about using it. I don't use it all the time.
Well, can I just suggest that you might use it when the bowel prep's as good as this? I would just use it consistently. So I think part of your problem here is the colon is quite distended, and I would take all the gas out, and when you've got the gas out, I'd fill it with water. That's the first thing. Now, the second thing is that you've said that you want to put the patient on their back, and I think that's a perfectly reasonable thing to do. But I would like you to explain to me why you think the patient should go on the back and what effect it will have.
Well, if I turn the patient on his back, yeah, the sigmoid will open a little bit more, because now there is the gravity.
Yes.
More pulling, and then it will open more. So
that's right. You remember John's diagrams of the sort of very collapsed left sigmoid colon. So it will tend to open it up. So the angles will be less acute. They'll be less narrow. Okay. So, but you've still got some gas in the colon there. What I would like to do is take as much gas as you can out, in fact, all of it out, and then fill the bowel with water. And before we move the patient on their back, I want you to see whether you can manipulate or get around this corner with just the water, please.
Okay. Here I'm already, I'll stand up near each side. I think I'm pushing too hard a little.
So, all right. So what I want you to do is just keep movements very slow, tip to flex down and pull back as you do so. That's it. And walk slow. So down and to tip left. That's it. So tip left. Whoop, stop. And now pull back rather than advance. Okay.
I'm pulling.
Good. Okay, so right, then you get to a point where you pulled enough, and then you go back in with some clockwise torque and a little bit of water just to help you through.
If I'm doing clockwise,
yeah,
it's turning in the other direction, so I'm sure
there's some paradoxical movement. Okay, well, it depends on your tip deflection, of course. Just slow movements. Is the patient all right?
Yes, the person. I think so.
Okay. So just it's very slow movements. You've got some air in there, so take the air out when you see the air, and fill it with water again. Right, now very slow movements. Slow. You've got a fairly straight scope on the scope guide, so it shouldn't be too much of a problem for the patient. So just progress. That's good. Just a little bit further.
Gaat het, meneer? Doet pijn?
So if you can hook round that bend, which is about 10 o'clock, now 12 o'clock, so tip deflect up. And as you hook round the bend, you should try to pull back. That's it. There we go. That's good. Very, very good. Okay, so just take the gas out if there's any there. And very slow movements. And just keep repeating that process if you can. You deflect around the bend and then pull back and then advance. That's it, very slow movements. That's very good. That's very good. So if you go slower, you've got more time to make the adjustments. But when it gets difficult, Louisa, you should have a mind voice screaming in your head, slow down, because when it's difficult, you can't do it when you're fast. So find fast all the time when it's easy, that's absolutely fine. But when it's difficult, for God's sake, slow down.